Days, weeks, months, years. Routines built to blur what really matters. Lost in deadlines, curriculums and others, that we forget ourselves. We forget how precious a moment is to hold with both hands. One moment could save your life, but if you miss it, the next could take it.
The prostate is a small round gland located in front of the rectum and sit at the base of the bladder. It's part of the male reproductive system, and its main job is to produce a milky coloured watery fluid that nourishes semen. From birth to young adulthood, the prostate grows from the size of a pea, just something like this, to the size of a golf ball. Prostate cancer is the most common cancer in men. Your GP might make an appointment for you to see a specialist if, after having a blood test which returns a PSA, which is prostate specific antigen, in short PSA, of 3 nanograms per milliliter or higher. Prostate cancer often has no early symptoms. An advanced prostate cancer can cause men to urinate more often, i.e. go to the toilet more, or have a weaker flow of urine. But these symptoms can also be caused by benign prostate conditions. So just because those things happen doesn't mean that you have prostate cancer. So it's always good to go and see your GP and get things checked out.
There are many centres and groups who support men with prostate cancer, and to find them all you need to do is go on the Macmillan website, and at the top you will find a button called In Your Area. Then type in your address, information and support centres to volunteering opportunities. You can filter your search to meet your needs. We went to one of the centres and asked them some questions.
My advice to any man who maybe gets into his 40s, I would say be very vigilant, watch yourself, anything unusual happening in that department, get yourself down to the doctor and tell him or her that you want a PSA test. Your own doctor will give you a test and keep testing you, because it's very, very important. As is my case, I had the classic case, it was caught early, I had to be treated, it was a one-off treatment, and that's it. So my advice is be vigilant, and if you have to, be firm with the doctor, say yes, I want that test.
But my wife is my rock in all this, and it weighs heavily on her, the situation. For people who do have advanced cancer, for whom the surgery hasn't worked, in my case, I was in a very dark place last year. I was very depressed, and had the good fortune to discover I also had severe heart disease. I needed 3 stents in a hurry, and as part of my cardiac recovery was given access to a talking therapist, which I needed because of my cancer situation, and the therapy worked wonders for me, and I 12 months ago I couldn't have said any of this to you without crying. It's just so I think emotional and psychological support for cancer patients is massively important.
Well, he hasn't gone for any treatment or any appointments without me being with him. I think they need support. You've got to be with them to help him to get through it. You know, it's the only way. You can't just say, because it has been known that we've had the odd one that's come to the meeting and the wives won't come with them. They won't go to any, it's not been good, and they've been really upset because the wives won't support them. Or can't, should I say. They just bury their head in the sand and hope it's going to go away.
We've been married for 46 years now, and we are very much a team in life. It's us against, not us against the world. It sounds like things are antagonistic, but we are together in all things. We're still very happy together. We've never had individual bank accounts. Everything's in joint names. The house, money. I earned it. My wife spent it. But it's I don't know. I wouldn't have bothered surviving if it hadn't been for my wife. She's made it worth fighting, and now, as I say, I'm tearing up slightly. But yeah, I'm stronger now because of her.
An experience I have, my father had it, 7 years ago when he was diagnosed with it. I don't think we really understood it as a family, and it again brought home to us the reality of what this illness can do. But also his recovery brought home to us that it is something that is very treatable, whether it be simple things, small medications, or whether it be chemotherapy or a dose of radiation. And let me not scare you, the radiation was low. It required visits on a daily basis. I think it was over a 2-week period. We are 7 years on, and he has been pronounced clear. And if you are 45 or over, or in your 40s, go see a GP, because really I don't really want to be the one in 4 that gets it. If you don't want to do it for yourself, then think about the person, the thing, whatever the appropriate statement is that would motivate you outside of yourself, and do it for that.
Men are their own worst enemies, because an awful lot of them will not come to terms with it. But to any man out there, I would say, have a look at my example. I had no symptoms. I found out completely by accident. And an awful lot of guys I talk to have also found out by accident.
It is different to man flu, because as men, we do look for sympathy. You have the sniffle. Oh my gosh, I'm dying. Right? So it's important to make a differentiation between that and one where it's a real medical thing, where there is an issue and we are apprehensive of going to the doctor because we could be told something that we don't want to hear.
I had no problems with the treatment. Like I said, 19 sessions. It took me longer to go to the hospital from home than the sessions. The sessions lasted minutes, really. And the nurses at Christie were absolutely fabulous. They were.
Yeah.
And I guess, this is not a statistic, but I guess more people are treatable and recover from it than those who don't. So that's the message that we need to get through. It's treatable. It's not like man flu. It's nothing to be afraid of. And insist on getting checked.